Hi, everybody. It's Yvonne DeVita and Dr. Larry McDaniel with another Scratchins and Sniffins Out Loud, and we're talking with Dr. Grace Long. Today we're going to cover arthritis in dogs, and we're going to do a little bit of discussion on how diet affects that. So I want to welcome everyone to the podcast today, and welcome Dr. Larry and Dr. Long. How is everybody?
Doing just fine. Glad to be here.
Yeah, I'm fine too, Yvonne.
Yeah, we're glad to have both of you. You know, I can start off the conversation. I did notice in Carmel, my Labrador Shepherd mix, who was Dr. Grace 15 when we lost her, I did notice quite a bit of trouble in her hindquarters that I attributed to arthritis. My vet never really diagnosed it, but we started giving her an over-the-counter medication, and now I'm wondering if I should have been paying more attention to her diet.
Probably. Actually, what you saw in her is very common, that as they get older, you see more arthritis. It's just like with people. And diet is a great first step because a lot of times that really helps the situation and you don't have to go to medication.
Oh, that would be great. Tell us some more about that.
Well, we've done a lot of research, actually, on arthritis and the effect of diet. And one of the ingredients that we found that is very effective, actually, is fish oil. And fish oil brings in some good omega-3 fatty acids, high levels of those, in fact, and they have an anti-inflammatory effect. So they actually help to reduce the inflammation that's associated with arthritis, and that benefits the dogs in a very natural way.
Wow, that's
yeah, you know,
great.
Grace, I take like 2 or 3 grams of fish oil a day myself for exactly the same reason. The anti-inflammatory properties, and with all the times I've fallen off my bike and broken bones, you know, I think it helps. It definitely helps because when I go off of it, I can tell that my joints are more painful.
Right. I do the same thing. I take 2 grams a day, and it has not only anti-inflammatory properties, but it's supposed to be good for your kidneys and your heart and a lot of other things. So fish oil is very advantageous.
You know, Grace, one of the things that we talk about when we talk about like hip dysplasia in particular, and you mentioned the research that Turina has done, and I'm thinking specifically of that lifelong study in Labradors.
Mm-hmm.
You know, one of the things that I remember from that study that was so powerful was how you fed those dogs as puppies had an impact later in life on whether or not they would develop clinical signs associated with hip dysplasia or the osteoarthritis. Can you talk a little bit about that?
That is really a good point, Larry, because I think a lot of folks like to see a fat, roly-poly puppy, and if a puppy is too thin, they get worried about it. But the reality is we proved through our lifespan study that if you feed a dog, starting from when they're a puppy, so that they are nice and thin and lean, you are going to delay any development of osteoarthritis in that dog. It's going to be later and less severe than if you feed them to be a heavier dog. It makes a tremendous impact on them.
And that's even in a dog that is genetically predisposed to something like hip dysplasia.
Definitely, because in this study, these dogs had the same genetic makeup. In other words, they were from the same litters exactly in the 2 different groups, so they had the same genetic composition, and again, there was a tremendous, almost a 2-year difference in the onset of osteoarthritis in the thin dogs versus the heavier dogs.
Yeah, Yvonne, that's why I did that post on body condition not long ago and feeding to body condition. So that's one of the most important reasons for feeding to body condition is not only delaying the onset of arthritis, but even other chronic diseases. So how you feed these animals as puppies really makes a big difference on whether they're, how their joints are going to be when they're 8, 9, 10 years of age.
Interesting. Now, so how does exercise fit into that?
Well, exercise helps to keep the muscles strong and the joints strong, and obviously those muscles have to support the joints. So that's all very important and tied in together. It's diet and exercise together that's important.
There is a therapeutic diet that PVD makes specifically for this condition. And I think that's what you were talking about earlier with the omega-3 fatty acids.
Mm-hmm. It's called JM, Joint Mobility. And I think a lot of folks have heard about the benefits of omega-3s, and what's really cool about our research is we not only fed this to dogs, but we actually looked at the joint level to make sure that those fatty acids were incorporated into the joint fluid and got to the target, and we proved that they did. So it was a great study, and it's a great diet. And also, there's nothing easier than just to feed a dog. So if you can avoid or delay having to put a pet on medication or NSAIDs or something like that for arthritis, that's the way to do it in a natural way. And in fact, to build on that, there's a lot of folks that have young dogs that are a breed that's just very prone to arthritis, and they'll put them on a diet like this to try to delay the onset.
Where can our listeners go on the Purina website to get a little more of this information?
They can go to PurinaVeterinariDiets.com to get information on the JM Joint Mobility Diet. And your veterinarian also has a rebate where if you have your dog on the diet, you purchase 3 bags and get the 4th one free.
Grace, what is the incidence of osteoarthritis in dogs?
It's actually about 1 out of 5 dogs, adult dogs, has osteoarthritis.
And do you have a favorite pain medication that you use in practice to control pain in dogs that are severely affected?
Rimadyl.
We used that on Darcy there towards the end, and it seemed to be pretty effective.
Yeah, although I say that only because it's been out the longest and I'm most familiar with it, but there are a lot of other medications that probably are equally effective, and I think even some that only have to be given once a day. But again, they aren't without some risk. You have to watch the animal carefully and do blood tests occasionally to make sure that they're doing okay.
So because, as with people, when our pets, our dogs age, they're likely to have issues with their joints. We really need to start looking at the long term, and so we need to start these good diets and exercise when they're young. Well, I think people understand that. We talked a little bit here about weight and lean as opposed to chubby. So how do you tell that?
Actually, if he looks too skinny, he's probably perfect. Well, there's 3 things that you look at. You do what we call a body condition on an animal to see where they are. And one of the first things you do is you run your hands along their sides to see if you can feel their ribs. And with light pressure, you should be able to feel the dog's ribs. If you look back from afar, you shouldn't necessarily see the ribs, but you should easily be able to feel them. And then when you look at them from the top, they should have an hourglass figure. They should actually have a waist that comes in behind the rib cage, even in a puppy. And then when you look at them from the side, they should have a little tuck. Their abdomen should tuck up. So if their abdomen goes straight across, then you know that's extra fat that they shouldn't have.
Interesting. Now, Dr. Larry, you did talk about that, and we have an actual blog post where you talk about the body index, correct?
Yeah, and I even linked to pictures that help describe what ideal body condition is. It shows a dog in silhouette, and we have puppies and cats. We have ideal body condition for all of them. You can go, I think Purina.com has the body condition score silhouettes, because I think I linked to that website to show those. And it just gives you a visual depiction of what Grace was just talking about, how to assess your own dog's body condition.
Mm-hmm. I think that'll be very helpful. So are there any final things that either one of you want to mention about arthritis in dogs and diet?
Just that it's a very easy thing to do. If your dog is starting to just seem to be slowing down a little bit, not getting up as fast as he used to, or not wanting to exercise like before, maybe it's time to try a diet like JM.
And so people should talk to their veterinarian about it, because this is a diet that they would get at their vet's office.
Right, and be sure to reference the rebate that we have, because all veterinarians may not be aware of that.
Sounds good. Well, thank you both for helping us understand arthritis and diet. This is Yvonne DeVita signing off from Scratchins and Sniffins Out Loud.